Hello everyone. Today I'm going to discuss about Attention Deficit Hyperactivity Disorder, which is commonly known as ADHD. ADHD is a type of childhood disorder which primarily affects the frontal part of the brain. By frontal part of the brain, I mean this portion of the brain. This portion of the brain is primarily concerned with carrying out executive functions. By executive functions, I mean sustained attention and focus, good calculative ability, adequate fund of general knowledge, intact judgment and decision-making capacity, and most important of all, self-regulation of one's own behavior. By self-regulation, I mean keeping a check on one's own behavior depending upon the feedback provided by these functions into our own behavior. Dear parents, I'm going to tell you about a list of symptoms, if present in your children or the children around you, should raise a suspicion of attention deficit hyperactivity disorder in them. So listen to these symptoms carefully. We broadly classify these symptoms into three categories. The first category involves attention. For example, if I enter the room and my child is sitting on a sofa and I address my child directly, and my child is not distracted by anything like TV, iPad or phone, and I am addressing her directly, calling her name directly, and she fails to respond. And if that has happened several times repetitively in the past few months, now that is a matter of concern. In addition, if the child fails to finish his homework or classwork frequently, makes silly mistake, fails to pay attention to finer details, ends up getting disorganized, loses things frequently like his pen, pencils, copies or notes, so as to get labeled as forgetful. Now that is something to feel worried about and take a consultation. The second set of symptoms involves increased motor activity. For example, if a child keeps running around or even climbing up in a situation which are considered inappropriate, for example in a restaurant or a classroom, or if he keeps fidgeting with his feet or hands, keep tapping them, keeps squirming like this in his chair, or talks excessively, is labeled as on the go, difficult to keep pace with, as if driven by a motor, then that child is probably suffering from hyperactivity. Now, third and the last symptom is called impulsivity. By impulsivity, I mean hasty actions or decisions that occur in the moment without forethought. For example, if a child blurts out answer even before the question is complete, or if he fails to wait for his turn while in conversations or while standing in a queue, if he is considered to be intrusive and interruptive because he frequently keeps butting himself into others' conversation or games. Now that symptom is called impulsivity. Imagine a child in whom these functions have gone wrong. Imagine the consequences that he has to face because of this disorder. He gets dropped out from the school because he is unable to sustain focus. He gets rejected by his peers because he is too disruptive and interferent. And if the disorder continues in the adulthood, then the consequences are even bigger and disastrous. For example, unemployment, social rejection, broken marriages, and because of lack of self-regulation and lack of good judgment, involvement in antisocial activities, drug abuse, even leading to incarceration. After listening to what has been discussed so far, if the parents find any of these symptoms in their children, then they should not hesitate in consulting a mental health professional like a psychiatrist or a psychologist. We should have the final say in deciding whether ADHD is present or not. Thank you.